A new study finds the maternal mortality rate in Texas has nearly doubled during the past decade. The study, published in Birth Journal last week, finds the Texas maternal mortality rate reached 32.5 in 2015. That's up from 18.3 from 2006 to 2010. Researchers conclude the increase is partially due to over-reporting of maternal deaths, and more efforts are needed to strengthen the reporting of death certificate data. Abortion advocates try to twist maternal mortality rate as another reason women should have access to abortion. Citing maternal mortality rates, a November Planned Parenthood blog post said, "When politicians propose 6 and 20-week abortion bans and threaten birth control access, excuse us if we call foul on their disingenuous concern for women's lives." To help us untangle the lies from the truth here, we're joined by our next pro-life guest. Gloria Purvis is co-host of EWTN's own Morning Glory radio show and chairperson of Black Catholics United for Life. It's so good to see you in studio, Gloria.
Good to see you too, Catherine.
I love having you here. Why is the maternal mortality rate so high? Shouldn't we have higher medical standards than this? It's the United States, it's 2018.
Well, the CDC actually says that the pregnancy-related death rate for women in this country is actually low. But if you want to look at the numbers of Black women, white women, or non-white Latino women that die in pregnancy, Black women do have a higher rate comparatively. But overall, the number itself is low in this country, but some women have higher risk than others.
So there's lots of different numbers from lots of different resources. And as I mentioned, abortion advocates really try and take these numbers and this data and twist it. Planned Parenthood Black community tweeted out in November that if you're a Black woman in America, it's statistically safer to have an abortion than to carry a pregnancy to term or give birth. Gloria, what's your response to that?
Well, I had several reactions when I saw that tweet. The first thing that I thought was, well, in the maternal mortality rate, it doesn't capture all pregnancy outcomes. The denominator is looking at all live births, so they've excluded the other pregnancy outcomes, which are miscarriage and abortion. So you don't really have a clear number there. Secondly, I thought it is absurd to think that Black women's bodies somehow are incapable of carrying a pregnancy to term. We know how God designed the female body, and it was meant to be able to carry babies to term. And that tweet somehow positioned the unborn Black child as an enemy of the Black woman, sort of, you kill that baby first before it kills you. And I thought it was particularly odd. The third thing I thought about the tweet was that it seems to then, if you follow, that Planned Parenthood is saying, well, now we're so successful at abortions, is instead of killing both the mother and child, we now only kill the child. To me, that's an argument for them not needing any more federal funds. If they're so good at what they do, let that $500 million go to Black women who have poor maternal health outcomes. It should go to Black women and helping them have better prenatal care, better postnatal care. We know that with the increasing numbers of hypertension, diabetes, and chronic heart disease, that money should go to that kind of care for the Black community. So
Planned Parenthood is an expert at abortion, not so much with the actual healthcare part of it, which can be seen even just in their messaging. Gloria, you have to question, with that kind of messages coming from Planned Parenthood with this data, what's their intent? What are they trying to do?
They're trying to drum up more business, and they're trying to tell Black women, look, you're safer to come to us and let us terminate your pregnancy than you seeing it through and taking your chances, which I find particularly odd, because as I was looking at their tweet, I thought, wait a minute, this is the same account that tweets a lot in support of Black Lives Matter, which the premise is, don't unjustly criminalize Black people and have the police be afraid of them and therefore kill them. But that's sort of the same tactic they used here with the unborn Black child. They have now created the unborn Black child as if that child is some kind of criminal threatening the life of the mother, and therefore the mother should be fearful and the mother should kill first. Well, I've got news for them. Black lives do matter, even in the womb.
Amen. Thank you so much for your reflection on this and your thought on this, so that we can take this messaging from Planned Parenthood and actually speak the truth.
Amen. Thank you for the opportunity, Catherine.
Gloria Purvis, so good to see you.